Um, Great. Well, thank you for inviting us here to this conversation today. My name is Kara Copeland. I serve as the Executive Director for the Oregon Association of Relief Nurseries. We are a supporting membership organization for relief nurseries who are private nonprofits actually doing the work of working with families, raising young children in their communities across the state of Oregon. So I've been with the Oregon Association for 5 years. Prior to that, I helped start a relief nursery in my own community. So I think that's where I will go to why I'm involved in this work and why I am just really passionate about the work that we do. And it's so fun. I think what's fun about relief nursery work is that we're a community-driven organization. So we bring in community members, business leaders, pediatricians, judges, families to do this work together. And that's been really fun to see that emerge in my own community. And now I get to sit back and watch other communities around the state of Oregon come together and build relief nurseries in their community. So I think too, my second thing I would say of what is fun to watch is just watching the light come on for parents who are reminded that they can do this and that they enjoy and love doing the work of raising their children and building those relationships. So many of our families are experiencing extreme stress. And when I see a parent just have that delight in their child, any of our home visitors and teachers just delight in children. I think that's where, to me, what keeps me going. So it's a little bit about me.
Thank you so much, Kara. Really appreciate that. Tobiah, can I move to you to introduce yourself and share a little bit about what motivated you to join the Relief Nurseries?
Yeah, I am Tobiah Brown. I'm the program director at Mountain Star Family Relief Nurseries in Central Oregon. So we're a tri-county program. We're rural and not rural all at the same time. What drew me to relief nurseries? Oh, I think, the future, right? Children, when you work with them, when you look into their faces, you can clearly see what tomorrow could possibly look like. And so they're like this little attraction that you're like, I want to be there. And then also just seeing families develop. So they go from being what they are and wanting to be something else to taking the steps to become that and sharing in the pleasure of that with them, and also just getting to witness it. So yeah, so that's what brought me.
Thank you, Tobiah. It's beautiful. Wonderful. Renee, I'll move next to you.
Sure. Thank you. Sorry, I have a little issue with my mouse this morning. I'm Renee Smith. I'm the Executive Director of Family Tree Relief Nursery. We're serving Lynn County in Oregon. We're a small rural, we're a large rural county with a small population in the smack dab in the middle of the state in the valley. I've been the honored to be the executive director for almost 18 years. 2024, I think it'll be my 18th year. And I think what drew me to the nurseries is still why I go to work every day, is that I see families struggling. I raised my own children in my community, and I was blessed with supportive family and resources. And I have met families along my lifetime at being in this community of over 30 years. And meet families that didn't have that. And so when I heard about a program that offered that, I wanted to be a part of it. I thought I was going for a board member interview, didn't know I was going for an interview to be the executive director, but here I am. And what I've learned is that a parent's love is strong, and children bask in that. It's what they need to develop and grow to be contributing, loving adults. And to see parents in a moment much to, as Kara said, to utter delight in their children, and to find out that they learned something they didn't know that changed how they viewed their child and their family. It's really rewarding just to see that aha moment for them and to see them really delight in their children.
Thanks, Renee. It's wonderful. And Amber, we'll end with you. Thank you.
Wonderful. Thank you. I'm Amber Ziering. I'm the program director for OARN. And coming to Relief Nurseries was all about the values. Having an organization and a model that believes radically in the capacity of families and the magic of their relationships, and that families are coming to build their own strengths, that it's not a deficit-based program, that it's just focusing on helping the family discover their own magic that's already there within them, and that joy in parenting. And I'm so drawn to the fact that we get to radically believe in people, and that's such a breath of fresh air in these times.
Thanks so much, Amber. I mean, just hearing your introductions, I cannot wait to dig in more with you guys. And nurture connection, one of our essential tenets and guiding values of this network is parent leadership, parent partnership. And so we really look forward to hearing more about what that looks like in your own work, because it obviously is very critical, and even just why you guys are drawn to this work, and what brings you to work every single day, right? Gets you motivated to get up and do the work that you do. So let's just perhaps start with a little bit of a broader overview, just so we all kind of understand who OARN is. So we'd love to just understand, I gave a very brief introduction of OARN, but who is OARN? What are your goals? What are you thinking about? What are you working towards prioritizing? And just a little bit about who the people are that are involved in your work as well, just so we all have a sense of the broader landscape here.
I'll go ahead and start, and then I'll let my friends jump in, because we might have lots of different perspectives of who OARN is. So when we say the Oregon Association of Relief Nurseries, we are a network of 15 nonprofits. They are all members of OARN, and they are running relief nurseries, serving children and families in their own communities all around the state. The work that OARN does is to find out what they need to make sure that they can be the most effective, and then work towards providing those supports. We also, so we do training, we bring leaders together to do capacity building. We're doing things, we help support advocacy efforts. So relief nurseries are funded as a public-private partnership. So I spend a portion of my time talking with our legislators and our governor and individuals around the state, from the Department of Early Learning and Care, making sure they understand what relief nurseries do, why we are important. Of course, we do that individually, that advocacy work also individually in communities. As we are bringing legislators on tours, we are bringing policymakers on tours so that they understand that value of investing early and investing often. So, we have 15 nonprofits running relief nurseries. In about 2 months, we will have 16 nonprofits running relief nurseries across Oregon, because we are bringing on our next community. We are located in 38 sites across the state. So 2,300 children annually receive relief nursery services, which I'll just say in brief is a combination. And Tobiah is with her team is doing this work every day, so she can put some meat on the bones here. But we're a combination of therapeutic classrooms for children ages 6 weeks up to age 5, not yet in kindergarten. We do home visiting and parent coaching in the homes, and we provide parenting education supports. Those are the core things we do, along with the wraparound supports that parents need: diapers, emergency respite, clothing, food, access to food, referrals to mental health, addiction services, really helping families as they've identified their own goals, helping them get there. So, and connect to those really important tools and services. But that's just a big picture of who we are. As you said in the intro, Relief Nurseries have been operating in Oregon since 1976, about the time Starbucks started. Relief Nurseries also started, to put it in a caffeinated context for us. And, we work really hard to make sure that Relief Nurseries are embedded in their communities. We require volunteers to serve in the direct service. We have volunteers on boards and fundraising, and just to ensure that these are services that and supports that the community wants and desires and are responsive to family need within those families' cultural context. So OARN, as they support organization, our work is to listen. Our work is to come alongside, and to ensure that Relief Nurseries are marching towards their own visions for what they want and need to be in their communities. I don't know if any of my friends would add to or subtract from what I've said, but I invite you all to.
I would just add, Kara, this is Renee, that how you just described OARN is exactly how we describe our services to families. So I think, we have a lot of parallel processes within all of our organizations. And so I think of OARN, I love a web metaphor. I can use it. I love metaphors to begin with, but I love a web metaphor because when I think about OARN, it holds this network of nurseries together and links us to each other, but all at every level of our staff as you go out into the field. And so it links us with each other, but also into the depths of our organization. And so it's really our backbone. It keeps us aligned and working together towards our big vision and goal of supporting families and eliminating child abuse and neglect in the state of Oregon.
And I also think that OARN is like our validity, right? We practice infant toddler mental health, and that is so outside of the scope of preschool practice that people are used to. And OARN is like, this is what we do, y'all. Here it is. And you need to support it. And we want to thank you. And it's like, and so that is, for me, is a really big vein of one of the ways, like when I'm thinking of that web, it's one of the big thick veins, because it's like just offering validity for what we do for looking at family development and human development through this therapeutic lens, and then practicing it, right? We get to practice it freely through OARN. That would be the only thing that I would add on.
So Tobiah, maybe we can, and Renee too, we'd love to hear. So as you know, our network, it's all about promoting strong, positive, nurturing relationships between those babies and toddlers and their parent or primary caregiver or other caregivers in their lives. We'd love to hear, like, what does that actually look like? What does it actually look like to promote those healthy early relationships, to promote and support that emotional connection between the young child and their caregiver, and would love to pick up on this thread around infant toddler mental health and what that looks like for you. But yeah, just love to see, like, what does that actually look like in practice? What are you all working on?
I can jump in. Okay, so for us, it looks like parenting, that stereotypical parenting that's like full of nurturing and caring and responsive interactions with children. That's what we do. That's what it looks like practically. And so we do that with babies, right? And toddlers all the time. We bring them into our classrooms and we love them. We go to their homes and we love them, but we also do it with their parents. And I think that that is a bit of the critical piece. So these parents get loved on and they get nurtured and they get their buckets filled in ways that may or may not have been filled when they were children. And then they get to practice that with their own children. And so I think that that is one of the biggest pieces for us, right? So our conversations are around, your sentencing hearing is coming up. This is what it looks like. This is what it's going to look like for your kids to visit. How's that going to feel? How are we going to follow through with that? How are we going to support you around that while having your children in the program with their current caregiver or their newer caregiver or their other parent who hasn't been involved until now? All of those questions, we get to tease them out. We get to ask the hard questions. We get to listen to the answers, and we get to be responsive to those answers. And I think that that's empowering for parents, because another big piece of what we do in terms of parenting parents is we teach them to advocate, right? So if you have an issue and you bring it to me and I listen to that issue and then I respond to that issue, however, you know, this is one thing I would do. You know, what are some things that you've done in the past? You know, how did those things work for you? Okay, because you told me your mom did this and that wasn't a win. So how can we make this a win for you and your kids, right? So doing that, basically we're teaching parents how to advocate. So from 0 to 3, it's very like tentative, like they bring concerns, they set goals, we make the steps to achieve those goals, we walk with them through them. From 3 to 5, it's a little bit different. These parents are like, okay, this is what my child needs. And we're like, yeah, you're right. They do. Okay, cool. Let's look at services. Let's look at how we're going to support them in doing that. And for us, then the conversation then becomes, you know, they're going to kindergarten next year. You know, you can be on the parent program. Wait, what's it called? Parent teacher conference staff program. Okay, I'm totally drawing a blank on it. You know, you can be the class mom. You know, you can, and it's entering all these other ways of advocacy. And so really we get a chance to grow with them from having this little baby infant all the way to being like, no, I told the principal, blah, blah, blah. Good for you. I told my pediatrician, this is what, all right, then that's great. And so, yeah, so it's this idea of nurturing people, right, from birth to all the way through, and in different spaces. So not only primary caregivers, it's wonderful to work with mom. It's also really great to work with grandma. It's also really great to work with foster mom, because this was an emergency placement and we've had this child for 3 years and now you have, okay, cool. It's also great to work with social workers and other community programs, visiting home nurses, all of those programs has together, we get to come and support families. So it's that idea of nurturing parents and caregivers, nurturing children, but then also building in this advocacy piece so that they can go on to reproduce it, right? Yeah. And that was probably really vague. So I'm going to let Renee speak and then I'll think about more concrete ways. So
I love, as I put in the chat, I love to listen to Tobiah talk about this. So I would just echo everything that Tobias said. I think one of the things that way back when one of our home visitors told me is that we are not the sage on the stage, we are the guide on the side, and that we really support parents in creating what they want. And sometimes they don't know what they want. So sometimes it's just listening and validating what their feelings are and what they're thinking. And many times we are the first people that have ever done that. I would imagine almost every nursery has some type of value around respect and care. And so we really believe that parents know what's best for their children. They just need support and figuring out how that plays out for them. And sometimes they may realize that that what they know didn't work for them. They don't know what they need to do, but they believe that through this trusted relationship that we can help them figure that out. And then break a big goal down into little baby step goals. So they can be successful, because oftentimes they don't feel very successful, either through the systems within their family or within our community. Many of them did not like school. So the thought about sending their precious children to even a preschool or even an early childhood, they're very worried about that because they did not have a good experience with that. So we build a lot of trust, and to Tobias' point, help them build their own knowledge and their belief and their confidence that they love their children and they want to have a voice in what's best for them and how to help them grow through those very formative years.
And our context for that really is Brazelton's touch points, right? We're really looking at kids, looking at caregivers, looking at everyone involved in early childhood, from the janitor to the cook, to the mom, to the dad, to the everyone, and valuing passion where we see it, believing that parents, they do want the best for their child and they know what's best for their child, and they have just a ton of information to give at different developmental points in their child's life, and finding that information. And that comes through talking. We talk a lot. I think that is one practical way that we do this, is we talk, obviously. Sorry, let me know when you want me to be quiet. But we do home visits. We have therapeutic classrooms. Therapeutic classrooms are generally noisy, and not in a bad way, in a good way. They're noisy because teachers are going, I see you doing that. Oh, you brought this for me, right? They're engaging in dialogue with children from 0 to 3. They're talking at home visits all the time. So this is what we talked about last time. This is what's happening this time. So tell me how that worked for you. Tell me what steps you made. You didn't make steps. Tell me why. I hear some fear around that. What's that about? Right? And so we talk a lot, and we spend a lot of time talking. We spend a lot of time reflecting, because I think even outside of this classroom, when you're doing things like parenting parents, when you're parenting adults, that can be very hard. And our families are all under a lot of stress, right? And so interventionists then have to take that stress somewhere, and they take that to reflective supervision. And they have reflective supervision with their immediate supervisor, as well as with an outside supervisor that we've asked to come in and support our staff, so that we can talk it all out. Because as we all know, trauma is held in the body. And how do we get it out? One way, with type A women, I work with mostly women at my site, is we talk a lot. We also walk and we breathe and we do other things, but how do we process it out of the body? And it's very verbal for a lot of us. And so really making sure there's time for that. There's time for therapeutic classrooms to be therapeutic, right? Our curriculum is developmental. That's what we want children to develop along the trajectory that they're going to develop along, right? They don't have to be somewhere by September 15th. That's not our deal. It's a space in which children can grow and become who they are, and change that at any time. Right? Because sometimes they walk in, hi, I'm Elsa. Hi, Elsa. And then the next day there's someone else. Okay, great. And it's also the same for parents, right? Hi, I'm bad and unworthy, and that's why I need your services. And it's like, my love, we need one another. That's really what it's about. And then that changes to, okay, I think I got this. Okay. Oh my God, I'm gonna have another baby. Okay, great. And so watching how we take on identities, and then those identities change, and providing an environment for that. Yeah. And there was one comment in the chat wondering too about fathers. We work with a few fathers. I do want to say that. And I do think that establishing healthy adult relationships is part of development for a lot of parents. A lot of our parents, it actually depends on site. A lot of our parents don't come in with partners. They come in with fathers. Someone's fathered those children. They may or may not be in contact with them. They may or may not be incarcerated. They may or may not be in rehab or not. And so when those folks show up, we definitely support them. But I think more so we support the primary person in the home in establishing healthy relationships, and in using communication to have those healthy relationships. Yeah. And when fathers do show up, it's always a wonder and a gift, right? Because children really respond differently to lower register voices. And you're like, oh my gosh, that's hysterical. And it's fun. It's fun to watch dads play. It's fun to be able to invite dads into this environment that they're not always invited into, because we don't really care. Like, we really don't care. I don't know, are an addict. Okay, that's great. The question is can you put together this puzzle? It's got 5 pieces, all with knobs. Like, we invite them into these spaces where they're allowed to be something other. They're allowed to be very, very, very successful. And that's important for us. But yeah, it's not really like all the time. I don't know.
Yeah, and to Tobias' point, I think because our work is done not only in the classroom with the child, but in the home. So the great thing about this model is that our staff may be working on transitions in the classroom, moving from one activity to another. That happens at home too. And so whatever strategies or supports the children use in the classroom for that, then families receive at least one home visit a month. Some may receive more. If we're working with infants, they get a home visit every week because they're only in the classroom one day a week. But our toddlers and preschoolers get a home visit at least once a month. And so some of those strategies that we're using in the classroom around transitions, if that's something the family is working on at home, then our staff have a lot of amazing little paper cues and things that they use, visual cues that they help children with. So if that's what the family wants to work on, then we take those elements that we're using in the classroom and take them into the home. And often it's so fun because the children can teach their parents how to use them. Even little toddlers know how to move Velcro strips around, stickers around. And so then those families can start to use those strategies in the home. And then to Tobias' point, when you go back the next month, you get to ask everyone, including the toddler or the preschool, how did it work? How were you supporting each other in using it? And I think the piece about dads, I think, to Tobias' point, often we work with single caregivers. Many of them are mothers. Upon occasion, we have a father. I can think of one in particular who, when a family does have a father that's living with them, he may be out working. So our home visits during the day or the late afternoon, they may or may not be able to be there. But we had a family that we worked with, mom for years and dad upon occasion, because he would bring the children to the classroom. Mom had severe behavioral health and ended up having to leave the home and not be able to be in the home for the safety of everybody. And so then we had this beautiful 2 years of relationship with dad, with his 3 daughters. And he really stepped up and in to be able to support them during this time when they were not able to be in relationship with their mom. And then now he has a new partner and things are going well with them. And so we're like, okay, you've got this. They've said, we've got this. We're ready to strike out on our own. And we're like, awesome, we're here. If you need anything, just, give us a call. So I think it's really the beautiful thing about the model is that it allows the families to really determine what the work is going to be or what the relationship is going to be, because we can customize it to whatever a family needs. Same within the classroom. I always marvel. People say, well, what curriculum do you use? I'm like, our staff with the family sit down and decide what goals are for each child. They look at all these goals of the 8 or 11 or 6 children that they're working with, and then they figure out how to operate a classroom where everyone gets to work on their goals. And then at the end of whatever cycle, where some children are there for a year, so they may be working on the same goal for a long time. But somehow they meet those goals. And by the way, they learn their colors, they learn how to count, they do more of those things that we check off in kindergarten that children can and can't do. But it's a magic sauce, I'm convinced. I am not an early childhood specialist. I came from the business world to this work, and every day I'm astounded by the work that individuals like Tobiah and my program managers and our direct service staff, because it's just, you have to have the heart for it. You have to have this ability to be able to set aside whatever belief system you might have and leave it at the door and come in and be present for this family and support them, and then go back out and put back on whatever belief system you have. Mine's changed over the 18 years I've been doing this, but it's amazing what families can do when supported. And if you think about it, we work with parents maybe 2 or 3 hours a month. It's amazing what they can do with just that limited dosage. Now, we're always available if they need more supports, but the humans are amazing when they get support and care and nurturing. And we think about nurturing parents. It's amazing what a little nurture does.
Thank you, Renee and Tobiah. You are bringing to life what this actually looks like and the work it looks like for parents and kids and your staff members as well, and the role that they play. So thank you for all of that insight. I'd love to talk at more of a network level too. So for Karen, Amber, what have you seen as things that have helped accelerate or really move this work forward? And what have been some barriers or challenges as well as you've been doing this work over the past, few decades since the Relief Nursery started? But what's really helping and promoting the work, and what's getting in the way?
Well, I'll jump in first and then let Amber's work is, training every week staff members from across the state and working with programs to make sure they have what they need. So from my perspective as the executive director, we have added 15 relief nurseries in 10 years, and we've 15 different sites in 10 years. We've doubled our footprint over the last 10 years, which is tremendous. And also, as I mentioned, we started the same time Starbucks did, and they've got Starbucks is on every corner. So from a position of scale as the business side, I think about if this is the magic sauce that every community and family needs, why is it we don't have these programs available to every community? We are only in 20 of 36 counties in Oregon, and there are both systemic and financial reasons why. And I'll talk about this as some of the barriers. Relief nurseries are a public-private partnership. So we rely on private investment and public investment. And Oregon is really unique, or is one of the states across the U.S. who is taking significant steps in investing in early childhood, from paid family leave, from our investment in childcare, from our investment in a program called Preschool Promise, and some communities investing in universal preschool. I think that we are doing some really important and innovative work, and it is not enough. What we are doing, in fact, what both our early learning Department of Early Learning and Care director wanted to do and what our legislature decided to do, there's a gap. We did not get the investments that we know children need. The research shows that there's inverse investments, state investments across the life of a child. So when you look at brain development and what happens from conception to age 3, we talk about the first 1,000 days and then the first 2,000 days of life. We've seen that we've seen that inverted U graph that looks at, all right, we have most of our state investments going in where these latter stages of child development, when we are doing intervention, when we are trying to remediate the impacts of not investing early. And we know that parents are the ones that spend majority of the time with the child. So we have to be investing. This is a policy issue. We have to be investing in the time of life when the brain is developing. 80% of the brain developed by age 3, 90% by age 5. We have a short window of time to make the greatest impact on that brain's infrastructure. After that point, we're catching up. We will not, in our state, we know that investing in early literacy happens at conception, where that maternal health, the making sure that children have those nurturing environments. So, I think about some of the challenges that we have. We do not have a challenge with the model. The model, as Renee has and Tobias have described the magic of what happens, and the qualitative data that we have, which is parent voice, parents showing up and saying, matter of fact, you can go on for sure OARN's socials, our Facebook and Instagram page, and look at recent comments of parents commenting on some of the things we've posted and said, hey, I loved the Relief Nursery. This made all the difference. We have some videos coming out that have parents talking about the transformation that it has been made, in what Renee and Tobias said, when someone believed in me, it helped me believe in my child. I mean, that's, I sit on the data side, so I can see, we have at the end of this month, we're going to have a webinar where we're presenting some data. And I'm looking at some slides here showing that the reduction in stress in the first 6 months and then the first year of Relief Nursery services, we have data showing the reduction in stress. So a chart shows what parents are saying. Parents are saying, oh, someone believed in me. That's the reduction in stress. And then we have these tangible, and the data that we collect of, they have resources, reduced mental health, stress on their own mental and behavioral health, the ability to have the resources they need to care for their child. So I think both the quantitative data and the qualitative data show us that we know what works. It's a policy issue of that's a barrier. And then, policy leads to the state investment and state and federal investment. And then the private investments of finding the resources we need to expand and scale up our work. So Amber, I don't know if you have a perspective from the work that you are doing in your interactions with program directors from around the state that you would add to that.
I think one of the things that supports our expansion is the joy of work. As Tobias mentioned in the comments, that the teachers and the home visitors that work with us come from those stories, that the same stories, the same steps that the families they're working with are going through. I spoke with one of the founders of the nursery in Klamath Falls, and she said, I did this because I needed to have this when I was little. And I think of how different my life would have been if I had had a relief nursery during that time. And so as a leader in her community, she started one for other children. And it's the magic of knowing what can happen, and passionate people, that community advocate, and for a new nursery to come in, it's that person. It's the person who understands what a relief nursery can offer and has that vision for other children in their community, for the families in their communities to have that opportunity, and that opportunity to go through the natural challenges that is early childhood parenting for all folks, but to have that support that's there in place. And our teachers love their work. They love the way that they get to interact with families. They love that it caters to the family's desires and hopes and goals instead of catering to predetermined formulas. We do A, B, and C, and so we did A and now we do B. That's not the way that we run our programs. We're looking at prioritizing parent-child attachment or caregiver-child attachment and safety of the whole family. And that shows up in so many ways. And that helps folks come and work and stay engaged once they're there. And as I'm training new people coming in, I have this opportunity to see excited new hires that are there and just watching their brains grow and expand when we talk about, no, again, we don't do a curriculum. We look at what do the children in your classroom need? And even if you had a plan and today they need something different, that's great. Then let's do that different thing that they need for the day. I think barriers I feel like in many ways we're the best kept secret that there is. It's so easy to talk about and sell the idea of a relief nursery, and somewhat alarming at how few people have heard. And we had this wonderful opportunity, a grant for marketing that has put the existence of relief nurseries on the map. That's something that the network is able to do in a way local individual relief nurseries haven't been able to do. So the story is not only engaging the families in our services, we can find families that are looking for a place to believe in them, finding communities, finding that advocate, finding that one person that is going to rally the community behind them. And communities love their nurseries. They're so proud of them. We have community leaders of all different stripes of business and government and private citizens just excited to create this future for their community, and knowing that not only is it a future, is it helping children grow today, it's employment, it's resources, it's services that in long term make the community even better. As far as some of our other outcomes that we have, we know that families come in with significant risk factors for child abuse and neglect. You qualify for our services with 5 factors. Most of our families are facing between 13 and 15 when they begin their work with us. And about 90% of the children who graduate from our program do not experience child abuse or neglect in their lifetime. So we know that it works, and the right supports at the right time make all the difference. I think that's all.
Yeah, thank you, Amber. And the next question I have is around equity, and it sounds like you have a wide variety of families coming to these programs, and then you have that across the entire state. So how does equity show up in your work? I heard different aspects of the program being culturally congruent. In the chat, it was mentioned that 80% of your staff say that they have similar backgrounds, for instance, to the folks that you serve, the families that you serve. But I'd love just to hear, how are you thinking about equity? How does that play out to ensure that you're serving every family to meet the needs, the unique needs that they have?
I'll jump in, and then I think there's a statewide perspective, and then there's always the local perspective. So there are 15 different relief nurseries doing this work across the state, and they're all going to have a unique perspective, because part of what is a requirement of the model is that you're responsive to your community's need. So how do you measure that? How do you get that information is different in every community. I will say that this is just kind of my personal philosophy on equity. is that we are always learning organizations, leaders, and humans. So just being on the journey, I think for myself as a leader of this organization, I'm happy to be continuing to learn and grow and doing better. You know, from a data perspective, when we look at we are disproportionately across the state serving families and children of color. When you look at the proportion of in Oregon statewide families of color, is that a measure of equity? I would say no. I think it is one lens on, are we meeting a significant need? And who can most benefit from relief nursery services? I can't answer that from a statewide perspective because it's community by community. Who benefits from relief nursery services in Lapine, Oregon? Which is, I think, where Tobiah is sitting right now, probably from the middle of Oregon, is different from Multnomah County, Portland, Oregon, where 20% of the state's children live in one county, in Portland, in Multnomah County. So in high density urban populations, what are the unique needs? And to me, equity is looking at those unique needs and listening. I would say that OARN as a statewide organization is growing in this area and has a ways to go to be able to listen statewide to what families are saying. When we construct our strategic plans, we reach out to families. When we do our evaluation and research, listening to families and hearing from them is always either a guiding component or part of the work that OARN does. Our work is around research and strategic vision, strategic direction for the state. Each relief nursery is on their own journey regarding equity and inclusion. And so I know that I have 15 different stories to share around this. And I think coming from their voice is probably the best way, to look at equity. I would say, speaking about equity, is I'm not satisfied. I'm not satisfied with where to answer the question that we have available relief nursery services to every community, regardless of their ability to pay for them. This is what causes me angst at night, and where I feel the most pressure or movement of where we need to ensure that every family would have access to these services. We're not there yet. But I think we're doing other great and amazing things. I don't know, I think about the work that Mountain Star Relief Nursery is doing with the Warm Springs tribe. And I don't know, Tobiah, if you want to share a little bit of anecdotal work that you all are doing, or if it's too fresh, this is, I'd love to hear you respond to this as someone who's doing this work out in the field.
I can wait, Amber, until you go.
Oh, thank you. I'll touch on where we're shifting in our trainings. We're moving our trainings to every training having components of equity in it, instead of you go to your equity training and then you go to the how you do your job training. How you do your job is equity. And so it is a separate topic, and it's a topic that you can't talk about any of the other skills without looking at that lens, without saying, how do we ensure the child with the least with the most barriers is accessing something, is accessing this equitably. And we're also in this fall, we're hosting a symposium for all of the network. It is focused entirely on a values exploration. We have organizational values. We have the values that we hold as humans, as individual people, and our families have a set of values. And we're going to spend an entire day as a network exploring how do we show up in alignment with all of those values in a way that is meaningful and genuine. And we just are very excited about this opportunity. So then I'll let Tobiah talk about what it looks like locally.
Right. Okay, so to give you guys some background, I said that I work in Central Oregon, and that is where we identify. I think for a lot of people who work on the coast of Oregon, I work in Eastern Oregon. And so politically and ideologically, that's really significant. It's laden with a lot of stuff. And so, you know, when it comes to equity, we've had so many experiences, and you know, we have one program where people are like, oh, I thought that was only for white folks. And we've had families in that program. Please don't ever send that brown skinned girl here again. And what does that mean? And what does that feel like? And how do we bring them back to the best interest of the child? Because that's what we're talking about, is the best interest of the child. We're just here to support you in child development. So there's that. And then, oh yeah, there's so many things. And then, yeah, there's Warm Springs, right? That's our reservation out here. It's huge and it's very diverse and it's very, very, very political. And so our interactions with them have been very tentative. We wrote a grant to have an outreach coordinator, and we said, oh my gosh, we got this grant. Aren't you guys excited? And they said, how dare you write a grant without including us in it? And we said, right. Because that makes sense. If someone told us that, we would have been like, I don't think so. What? And so then they let our ED go to a series of classes on how you can interface with us in the most culturally appropriate ways. And we learned a lot. And one of the things that we learned is that time is a different experience. And so our expectations, our desired outcomes are completely different. So we have a couple of things going on with Warm Springs. One, we have an internship program where we have interns from the reservation come into one of our sites. They get to work with teachers and shadow teachers in the classroom 20 hours a week. They also take classes from the local community college. And so it's really us three organizations in that together. We also have an outreach coordinator who's working with families one-on-one. She's doing home visits. She's doing hand-over-hand parenting. She does that for about 20 hours a week. So what that looks like for us is an internship program that is going horribly, right? Like, we're like, this is not what we thought. We thought it was going to be different, because that's how we feel. And that's our perspective from the outside looking in. The feedback we've gotten is this mom who comes and sits in your class and doesn't really interact with children, and whom you feel like you constantly have to get after, she's being so much more attentive to her children. And we're grateful that you guys have given her this opportunity. And we're like, oh, we didn't even see it or think of it that way. And so I think for us, equity is really about the co-construction of services. It's really about sitting down and being like, this is what I want. This is my dream baby. What's your dream baby? And then pursuing that together, merging these little dream babies and pursuing that together, and constantly reflecting, constantly coming back. And being open to feedback across the board, right? Staff are overwhelmed. Folks in other EC programs on the reservation are just thrilled to death. And it's like, okay, so receiving all of that feedback and sharing all that feedback across the board. Yeah, equity to me is another talking point where it's like, okay, so what do you think? This is what I thought, and I was wrong, and I can be wrong. So what do you think? And how can we move forward? And how can we change it so it's something that feels good for everyone? And I mean that, how does it feel good for everyone, right? So even when we're looking at staff, what sort of benefits do we have? What's our pay? Like, how are we making this feel good for everyone? What's equitable in this space? Yeah, we talk about it all the time, thankfully.
And I think across the network, every nursery has their own story, to Kara and Tobias' point. So I'm on the opposite side of the mountain range from where Tobias is. And in our county, there are not, so I think from our perspective, our equity and diversity work is at the family level, because we don't have a system that represents communities of color or experience within our county. We don't have a reservation or a large rural county. We don't have nonprofits or community-based organizations that have leadership amongst from the LGBTQ plus community or from the Latino community, or because we don't have that much population. There's just a lack of, well, there's a lot of reasons why we don't have it, but we don't. So from our perspective, we really believe that we have no scaffolding around that. So if you're a family, you come to us, we learn about you, and we help support you. And so that could be 2 women, could be, I mean, it could be any combination of any life values, color of skin. I mean, we just take what comes to us. And so, as well as hiring staff that have those shared living experiences from the communities that come to us. And so in our county, I think we have about a 15% population that identifies as Hispanic. We serve more than 40, usually between 35 and 40% of the families that we serve identify as Hispanic or Latino. So some might say we're overperforming in that metric when you look at a percentage of population, but we don't really think about it that way. We work to ensure that our services are available for anyone who comes to us who is feeling stress as a parent. We have built relationships family by family in many underserved communities within our larger community. And so it looks different in every community. And what we're learning is we just need to learn more, to Kara's point, about what barriers children and families are facing, and then how we can support them. I think internally, one of the challenges we've always, if we could hire every staff person to speak Spanish, that would be amazing. We've been working on that for 18 years. We are not there yet. It ebbs and flows. But I learned an interesting statistic recently. I'm not sure what the woman's resource was, but she shared at a leadership group that I'm a part of through OARN that Latino women are the fastest growing or having more babies than any other group today. And so I'm thinking, wow, we got to keep hiring more Spanish speakers, because when you do birth to 5 work, you don't have much time to catch up for that trend, right? So because they're gonna, they're already at our doorsteps, they're already sharing, their friends in their community are already sharing the work they're doing with us. And so we have to keep working on that. And then I would say the other piece, we have a lot of children that live in poverty in our county that are impacted by substance use disorder. And so we do our community, that is a big piece of our work. And so it is different, but depending upon the location, but I think having that heart for knowing that we don't know. So we have to ask the families to what they need and what that looks like for them. And then we have to go back and do our own work to learn, because it's not really their job to teach us about that, but it is our job to listen to what they need and what that looks like for them.
Wonderful. Thank you so much. Thank you to all of you. I know we're 7 minutes over time. I really appreciate this conversation so much. Thank you for the few extra minutes of your time. as well. This was the first, you guys are the first group of this latest series, and wow, what an amazing conversation to kick off these listening and learning sessions with. Feel so inspired by the work that you're doing. Some of the values, the principles, just the way you're speaking about your work and the families are just resonating so deeply with me. I have 2 little ones at home, and it's, there are lots of challenges as being a parent. And thank goodness that you guys are available to your communities and to the families that are there, because that certainly is not a support or resource that many communities have who could really use that support. So thank you very much for your time, for your perspective, for sharing the stories, your stories, other family stories, because it really helps us see what this actually looks like in practice and how people like you live these values out in support of the families in your community. So thank you very much. And with that, we will certainly be following up with you all. We're going to have a few of these and then determine how best should we share these stories? What's the right way to have others hear your work and your voices? So I'll be back in touch with all of you to kind of figure that out and determine, and we're always wanting to continue to collaborate. So you guys are a network, we're a network as well, right? We have lots of different partners at the table that range from a whole variety of child health, maternal mental health, early childhood, lots of different fields, all focused on how do you promote family and child well-being. So there may be opportunities to continue to connect as you guys are growing your work and your network as well. David, I'll let you just have any last words or any reflections before we hop off, knowing that we're 10 minutes
My
over.
heart and my soul are full, because the truth of, the beauty of those moments of nurturing and the impact that has for unmeasurable yet observable growths of families, their children, and then the communities. And as one of you said, it's unfortunately too hidden secret of the power of what is in fact happening with OARN and in communities and in those nurturing relationships that believe in the beauty and strength of every family when given supports. So to be continued, but thanks for the time, and we'll continue this journey together. Thanks.
All right. Well, thank you all. I really appreciate your time this morning, and we'll certainly be in touch. And please be in touch with us as well as things pop up. But thank you again for your time.
Wonderful. Thank you.
All right. Bye all. Thank you.